Hello, welcome to HFMA Talk, the podcast for NHS Finance. I'm Sarah Day, Policy and Research Manager at the HFMA. In this episode, I am joined by Rob Whiteman, Chief Executive of CIPFA, to discuss the local government response to Covid-19. The pandemic has had a big and positive impact on relationships between the NHS and social care, as we all work together to support our communities. But local government is not just about social care, and Covid-19 has had an impact across almost every facet of service delivery. Rob will explain more. So hi Rob, thank you so much for joining us today.
Well, it's a great pleasure to join you. Thank you very much for asking.
No problem. So could you start by telling us a bit about CIPFA and what you do?
So CIPFA is one of the UK's accounting institutes. We specialise in public finance. We're the only accountancy body in the world that does so. Of the 180 professional accountancy bodies in the world, CIPFA is the only one that focuses wholly on public finance. Roughly half of our trainee accountants are overseas. In particular, we train in many UN agencies and global organisations. So half of CIPFA trainees are overseas, half are in the UK, including very proudly to say the NHS graduate scheme. So we're very pleased to train in the NHS. We also train in the audit firms and in local government and in central government. We do three things. We're a policy body and a standard setter. So we set the accounting standards for UK local public services, such as local government and the police. We set the charity sector, SORP, and we're a policy commentator as well. We're a membership body, as I just set out. We train and qualify accountants. And then thirdly, we, like HFMA, we provide a range of services, CPD training, analytical and advisory services, particularly into local government.
Thank you. So let's talk a bit about COVID-19 then, and particularly what local authorities have been doing to address the pandemic. And obviously social care and care homes have been in the news a lot, but the breadth of response has been across a lot of other areas too. Could you talk about that a bit for us?
The thing to say at the beginning is hindsight is a great thing, isn't it? But probably we're all going to reflect when we look back that public services were not quite ready for COVID-19. A decade ago, a global pandemic featured higher on the national risk registers than it did immediately before this crisis. Of course, in the NHS, we know there was some exercises a couple of years ago that showed that there was particular need to address some issues. And also, I think for all public services, a decade of cuts meant that a lot of capacity had been taken out. So I think local government is like that too. And I know that applies to all public services. But when this is all over, we're really going to have to be careful and guard and advise against cutting public services to the point where they can't easily respond to a crisis as we would wish. That said, local government has made a magnificent response and it's acted incredibly quickly in spite of having lost so much of its capacity. And I guess it's doing a few things. Number one, it's trying to protect its local economies and to make them more resilient. BEIS, the business department, has put a lot of grant money through to small businesses, in particular in leisure and hospitality, and has administered those schemes through local government at very short notice. CIPFA was very involved in this, helping to draft the regulations to create the scheme and the guidance on how to administer it. And local government's been under quite rightly, a fair amount of pressure from government and businesses and commentators to get that money out to businesses as quickly as possible. In the last couple of weeks, I've done a couple of select committees. I did the MHCLG select committee and I did public accounts committee, and they've had lots of questions about, is local government getting the money out to local businesses that's needed in order to keep their economies resilient. Local government has then also led local programs to shield individuals. Of course, this includes the incredible number of people that came forward for volunteering for the NHS. And that's been an interesting exercise, because people being shielded are not necessarily people who would normally qualify for services. And actually people who may be self-payers or people that haven't had any clinical need. There's a range of people that actually are being shielded in a way who wouldn't usually receive service. And so that's led for the need for the creation of new data sets. We may talk about that today. And it'll be interesting when this is over to see, well, what does happen to people that have received or had a relationship with the council and the local community, assisting them in a way that they never used to. Local government has received some extra funding from government for the expenditure that it's deploying, which is welcome. And again, we'll talk about that. But I guess a big point to make at the beginning is obviously income features as a very big part of local government budgets. A district council, fees and charges, car park income, other things may easily account for 25% of its income. And income has collapsed. Now, some of that on an accruals basis might come back if people aren't paying their council tax for April and May. It will get paid later in the year, and so the budget estimates will be right. On the other hand, some income is clearly lost for good, and actually perhaps all income, including on a budget basis, will be affected because we're heading for a recession, and usually we have more trouble collecting tax when we head into a recession, and with sadly likely business failure and redundancy and unemployment that may follow. We think that income is likely to be a permanent problem for local government. Yeah. And then social care. I mean, obviously, I think we all had concerns before the crisis that social care is in need of a long-term funding solution. Local government has done its best to protect social care, against a backdrop in the last decade of losing 50% of government funding, and in real terms spending 25% less in total. Local government has tried to protect adult social care and indeed children's services by cutting other areas of its activity by 30, 40, 50%. However, social care was clearly denuded of resources before we came into the crisis, and a huge amount of effort has gone in from local government, securing PPE supplies, working with providers in order to make sure that services are being provided, and of course working with the health sector in relation to discharges in order that we have an overall system of social care and health which is capable of dealing with this terrible emergency.
So just thinking about the discharge, as you mentioned it there, obviously there was a big drive to empty the hospitals when this really started, and a lot of people moved out into care homes. And I'm interested, what enabled that? Was it just the extra money that you had, or was there other elements that contributed?
Well, obviously the money really helped. And again, when this crisis is over, will some of that funding, which has been put into the system on an emergency basis to try and manage the local health and care economy in a different way and accelerate discharges, might we keep some of that? Because clearly the money really has made a difference. However, I think what we've also seen is a huge amount of genuine local partnership working in an accelerated way. So it isn't only the money. I think we've seen, better communication, better emergency planning, fantastic efforts by everybody to understand where there are blockages. So it isn't only the money. I think this has really, in many places, accelerated genuine partnership working and frontline integration.
So the usual financial assessments weren't undertaken when people were rapidly discharged to social care. So what do you think this might mean for the future?
The removal of financial assessments means that those who would normally be classed as self-funding or would contribute to the cost of care may now be in receipt of publicly funded care. Now, it's really quite interesting. It raises a lot of questions. What will happen when those who've been in receipt of care and subsequently do not pass the needs assessment, but have been receiving care, what happens in those cases? So I think we've been in an emergency mode, and the government has asked local government and the health sector to work as quickly as possible on discharges. But actually, that's going to take quite a lot of tidying up afterwards, because financial assessments are part of the care assessment, in effect, for local government, and what's going to happen to people who've received care, but also then what's going to happen on an ongoing basis. So I think we're probably opening up quite an ongoing issue here that will need to be dealt with.
And that brings me on to the future funding for social care. What do you see happening?
I think one of the what's the long-term funding solution for social care? That's really at the heart of this, isn't it? Social care is being funded through local government, and property taxes, business rate tax and council tax are not the ideal way of funding social care. Those taxes on property and council tax tend to be a little bit cyclical in nature. When there's a downturn in the economy, then a bit less tax is collected. But transversely, that doesn't relate to service delivery at all, where costs are increasing. So there needs to be a long-term funding. Now, the government probably doesn't quite know what it likes, but it knows what it doesn't like. And so it's looked at solutions of, can you fund social care entirely from taxation in the way that the NHS is funded? Can you fund social care by some form of insurance scheme, particularly if people can't pay for it themselves in later life? Remembering at the moment that there's, in parts of the country, there's a fair amount of self-paying for social care already. So I think the government doesn't like the look of any of the possibilities, but because it's politically difficult to tax more or create an insurance scheme, actually social care has reached the point where clearly with rising demography, it's going to fall over at some point. My hope is that the solution, when it's framed, is genuinely for the medium and the long term. It's not a quick fix. One of the issues facing local government finance is that there are some quick fixes in the offing. There will be what's called the fair funding review to redistribute resource. Probably this will see money shifted from urban areas and metropolitan areas into rural areas and county areas. Counties in particular have faced huge budget pressures because they carry out the top tier activities such as children's services and social care, which have seen huge cost increases, but they don't have the wider range of services which can be cut in order to compensate for the resources needed there. So the fair funding review is likely to recut the cake, and there'll be winners and losers. And yeah, I'm an old cynic. I've been around a long time. My 30 odd years in this business, Labour governments tend to redistribute to urban and metropolitan areas, and Conservative governments tend to redistribute to suburban and rural areas, each claiming it's on a scientific basis. Usually redistribution to Labour areas is called transparent and fair, whilst redistribution to rural and suburban areas by Conservative governments is referred to as transparent and simple. And that's the code language for redistributing according to politics. However, we will get a fair funding exercise and we will see some redistribution. That has the risk of being quite divisive within the local government sector, where different tiers of the sector argue against each other for who should have the greater slice of resource from the fair funding review. But actually, the problem's the quantum. There isn't enough money coming into the system to fund it. And we need a solution for social care, which is an insurance scheme or some other form of funding. So I don't see that problem going away quickly. I guess the problem will be this crisis is going to last for maybe a year or two until there's a vaccine which can be rolled out to scale, or effective therapies to fight the disease. Is the government going to have the bandwidth to bring forward radical reform of social care funding? Maybe not for a year or two. So we're probably in the terrain of short-term fixes, and I think we're going to have to make do with the present system as it is for the time being, but lobby very hard for an alternative solution.
So we've heard from our members that during these last few weeks, relationships across the system have really improved for many, particularly relationships with local authorities, so the work with social care and so on. Do you think that's part of the solution? Obviously, it's not money, but is that better system working going to be part of it?
I hear exactly the same from local authorities. I think there's been fantastic local working on all sides. And in a way, it's not a surprise, is it? People are very passionate about their communities and want to do a good job. And the way I describe this is that usually it's hard for people to overcome the obstacles and the barriers in an often very centralised system, where during the time of an emergency, local systems are allowed and encouraged and have to get on and do things without as much top-down interference. And so actually there's been really good working, and everybody values that. And I don't think anybody wants to see it go away. I think, interestingly, some of the evidence from other countries where there are better systems working at the moment on testing, track and trace, where there is capacity to be able to track and trace everybody with infections. Actually, there's quite a lot of research, isn't it, that these are in countries where there is strong local government or strong local working. Germany, I talk about a lot before the crisis. Germany operates on a local system where local government has the ability to raise taxes and provide the services it thinks are needed without central government permission or central government funding. And so very often in those environments, we've seen innovation and people get on and invent ways of testing, track and trace more quickly than is possible through a national rollout. So there's no question that in every country, the central state operating in a coordinated way to get ventilators, to procure PPE, never has there been a time for more effective centralised government. But effective local working or local government, there is evidence in those countries they've been able to be more agile and to actually, perhaps get ahead of the curve compared to the UK. I don't know what happens. I think we see a government that has both centralising and localising tendencies. I am a localist by nature, and I do very passionately believe, although, I'd claim it's based on empiricism and evidence, I do very passionately believe that whilst the UK is quite good at sort of technical productivity, getting more widgets for a certain amount of input or economies of scale on a particular pathway, the evidence is that the UK is quite poor on allocative productivity, spending money in the right place to get value for money overall. And you can look at that on any of our public services, but for colleagues in the health and social care system, everybody knows that whilst we have a relatively smaller cake than some other economies, we spend 10% of our cake on health, and some other advanced economies spend 11 or 12 or 13%, the US a higher figure, 18%. Whilst we are macroeconomically cheap on health and spend a little bit less than some other systems, the way that we cut the cake is very different to other systems. And on the whole, those other systems spend a bigger proportion of their cake on prevention, on public health initiatives, on mental health, on the aspects of social care which are preventive, on community services, and relatively less on acute or secondary care within the overall system. So it's an odd thing to say, but the UK system is both productive and non-productive. It's technically productive in that we spend a bit less, but it's allocatively unproductive in that compared to other systems, we simply spend a lot less on prevention, which means that relative to other systems, we spend more on secondary and acute care. I think governments see the benefits of localization and partnership working during a time of crisis, but there will be higher public spending when this crisis is over. The government will need to make interventions. And I also see significant tensions for centralization. Actually, we've seen that in the last week or two, haven't we? Should tracing be something dealt with by big outsourced contracts managed centrally, or should it be dealt with by putting that resource into public health and local initiatives who have a track record on tracing? And you see that tension playing out quite a lot. So I don't know what would happen. I hear from everybody that the crisis has led to better local working and people would like to be able to get on and do more stuff together. However, I fear that the government has tendencies in both directions, and it's too early to tell what they'll do.
Now, you mentioned earlier that this has helped areas to better understand their population, the list of people who've been shielded. There is more information about the more vulnerable parts of society, potentially. Is that something which you think we'll be able to build on to support our health and care services as we go forward?
Yeah, very much. So I think the lessons from local government are that data sets that existed at the beginning haven't been adequate. And so people have looked for new sources of data, because actually the people that need shielding, you do want to base on health and care records, but actually you will also need debt and levels of debt or benefits or access to other services for vulnerable groups. And so local government has been working quite fast to try and have access to a broader set of data sets, and then use some analytics in order to predict who are people that are likely to need a service based on these factors. And I think we're at the beginning of that. I think everyone's eyes have been open to the investment that's needed in data and more advanced analytics on data. CIPFA is certainly trying to help in this space, and we've formed some partnerships here and trying to bring access to some new techniques to local government to be able to use. So I think this is the beginning of a new initiative where, again, when this is over, we're going to see that investment in data and data analytics, being able to manipulate data in order to look for client groups that haven't existed in traditional standalone data sets, is something that the local state health bodies and local government working together very much needs.
And I guess there's something there about being able to share information as well, isn't there? Getting over some of those barriers.
Of course, sharing information. We've all got our stories to tell, haven't we? Of course, we have laws on data protection and information management, but somehow that stands in the way of sharing information routinely and at scale to help the vulnerable and to provide better health and better public service outcomes for people. And I think because there's an emergency, that's been, people have been emboldened to be able to do something about that simply to get things done. And again, I think civil liberties and data standards and protecting the public are very important in this regard. But I think the outcome or the balance of what was happening before this crisis meant that very often people were saying, I simply cannot share the data that I need for the benefit of the public because the edifice, which is information management, is standing in the way of that. And I think we've been able to chip away at that quite a lot in the last few months. And I hope in a constructive and productive way, without losing the balance of civil liberties. I hope that we have a very different outcome on that in the years ahead.
Are there any other areas where local government has undertaken new initiatives as a consequence of the pandemic?
Homelessness, I think we ought to highlight. It's the work of Dame Louise Casey working with MHCLG and all government departments as well as local authorities to take as many people off the street as possible so that there are now far fewer rough sleepers on the streets. I fear that extra funding may well come to an end, but there's a lesson here perhaps about we don't have to have as many rough sleepers as we have as a society, and I think it'd be interesting to see what happens there.
And finally, is there anything else that you'd like to highlight about the challenges that local government is facing at the moment?
One of the difficult things we're looking at the moment is the statutory framework for council financial management. Colleagues in health will know that we have statutory finance officers called Section 151 officers, and they have a personal duty on them as an individual to serve a notice to freeze all expenditure if the budget is not balanced. This is called a Section 114 notice. Of course, in the last year or so, we had a couple of these notices served at Northamptonshire County Council. That framework presently exists. Now, CIPFA has made public that it would clearly be a disaster to issue a 114 notice at the moment, bearing in mind that would freeze expenditure, much of which is, shielding the public and carrying out vital work in an emergency. We are in a little bit of no man's land at the moment on that, where we're advising people not to serve 114 notices, to speak to government if their budgets don't balance. And government is giving some, I suppose, putting it bluntly, some equivocal language where some statements say all of your costs relating to this crisis will be covered. And then some other statements from the Secretary of State say there needs to be burden sharing and councils will have to pay for some of this themselves. So we are in a difficult position on this at the moment. There are a number of councils who are pretty close to the position where the Director of Finance would have little option because of the requirement on them as an individual professional, would have little option but to serve a notice at a time when we all agree it shouldn't be served. CIPFA's doing a lot of work in this space with directors of finance themselves, approaching government for councils that are getting near the edge, but also discussing with Treasury and CLG how we might make some temporary changes to this system of financial management. It's not easy because there isn't time for statute, and these arrangements that I talk in place are actually in primary legislation. But can we give Section 151 officers enough comfort that they're not going to get the sack if they fail to issue one of these notices at the present time? So this is something that CIPFA's dealing with on a daily basis.
Rob, thank you so much for your time today. That's been really good to get a local government perspective and to think about things a bit more broadly than perhaps we have been up till now.
My pleasure. Thanks very much for asking, and keep up the great work, HFMA and the profession in the health sector. You're doing an amazing job, and we're really proud of you.
All of the HFMA's COVID-19 related briefings, blogs and news articles are openly available on our website, hfma.org.uk. There is no need to be a member to access these, so please tell your colleagues. We have also launched a forum where finance colleagues from across the NHS can discuss issues and challenges in a safe space. You can sign up via the link in the network section on our website. If there are particular topics that you would like future podcasts to cover, then please get in touch via our email address, policy@hfma.org.uk. Thank you for listening to HFMA Talk. Don't forget to subscribe to this podcast to keep up to date with new episodes.